Hi everyone. I'm going to be answering two set of questions tonight. The first one is what are bars? That one is sort of simple and straightforward. The second question has to do with alcohol and benzodiazepines, and it's multi-part, and I won't answer all of it tonight. It is why do people use alcohol and benzodiazepines together? What are the dangers and what is the treatment? Which is quite complex, and I won't get too deeply into it. My name is Dr. B with Dr. B Addiction Recovery. This is a nonprofit channel and endeavor aimed at education. If you like the content, please feel free to push the Patreon button below, and for as little as $3 a month, you can contribute to our long term endeavor. Let's start with the question what are bars? This is kind of the street slang often referred to for Xanax, the 2 milligram bars, which is a tablet shaped like a bar. Other terms they use is Xanny bars. What is the big deal with this? Let me put it in a bigger picture, and I've already made some other videos regarding Xanax, and you can see those in our video series. Xanny bars, this is a benzodiazepine. Other benzodiazepines that you may be familiar with is Klonopin, Valium, Ativan, and there's temazepam, and there's a few other long-acting ones. And benzodiazepine fall under the general class of drugs called sedative hypnotics. And these set of drugs include such things as barbiturates, benzodiazepines, which Xanax is one of, and alcohol products. Okay. Uh, Structurally, these many of them are somewhat different, and some of them are the same. And one of the fundamental areas they work on directly or indirectly, or through many of the more complicated mechanisms, is through the GABA receptors. GABA, a neurotransmitter, which is an inhibitory, sedating, sedative, hypnotic transmitter. You can think of it as negative, and they all work on the same one, on the GABA receptors, and they may mimic or in some way, shape, or form affect the GABA molecule, which is an inhibitory neurotransmitter. I used to always think of these as negative versus positive and stimulation, such as things like dopamine or norepinephrine. This being said, what makes Xanax or Xanny bars so special? The issue, oftentimes people think of these as short acting, and they're not necessarily short acting that causes the extra problem with these. It's the fact that they are able to get into your system and cross the blood brain barrier rapidly and reach peak serum and blood brain barrier concentration rapidly. That's what makes Xanax a problem. In fact, something like Xanax and even Klonopin or Ativan, in terms of their half lives, are really kind of about the same. But what's happening with Xanax is it is packing a punch of getting to its delivery address quite rapidly, much more rapidly than something like Klonopin or Ativan. What does that mean? Well, that essentially means this. Let me give you an analogy. Sugar is a carbohydrate, okay? And you can have a simple sugar, which is just, let's say, pure white sugar or a chocolate bar, and that would be a simple carbohydrate. Or you can have a very complex carbohydrate, like a piece of bread. What happens with these carbohydrate type of molecules is this. When you have a complex carbohydrate, there's an extensive amount of processing, and the speed and kinetics with which it reaches its receptors is much more slow than something like an extremely simple carbohydrate, like a can of soda or a candy bar. And the idea, the theoretical idea, which has really proved to be quite true to a great extent is that the faster something gets to its address, the more it wears out that system. And in the case of addiction, it also creates addiction much more rapidly, or it has a much higher abuse potential. Let's go back to our analogy. No one talks about, in general, somebody eating a complex carbohydrate and being more prone to type 2 diabetes. But when you start feeding a child from early on basic sugars, candy, Coca Cola, you start to worry about getting what used to be called adult onset diabetes, type 2. And we have started to see over the years that younger and younger children are getting it because of these rapidly acting simple sugars. Okay? Now, translate that into benzodiazepines, which is a class of sedative hypnotics, which includes alcohol and barbiturates. And in this case, Xanax is one of the benzodiazepines. Xanax, in particular, rapidly gets to its destination in the nervous system. So you can think of this as almost a simple way to think of it is it's kind of blowing out your receptors pretty quickly and really desensitizing them or hypersensitizing them, whatever works for you to understand what is going on here. And you end up needing more and more and more. One other interesting thing about Xanax, which is a kind of a different sort of analogy, but it helps you understand why it's in the same class as alcohol, something like alcohol, is the following. Uh, it's sort of odd because people have Xanax trips or they describe their behavior on Xanax, including memory loss, violent behavior. They can't recall the things they did. They can end up in jail, stealing, hurting someone, doing something they're embarrassed about. It's just simply dangerous. And it's kind of odd because these same people can become aggressive, violent, hyperactive, besides themselves. And you don't think of that as a benzodiazepine, which is a sedative and a hypnotic, right? Because you can use these even before surgery. You can use a type of benzodiazepine for short-term memory loss so they don't remember the surgical intervention. Well, it does sound odd, but compare it to alcohol. Somebody might be able to drink beer and wine all day long, but they always describe to you, hey, if I have a shot of tequila, that's it. The night's over. I stay away from that stuff. Or if I have whiskey, it's a whole different animal you're dealing with. Now think about it. Isn't that just like Xanax? And many practitioners I've heard often talk about alcohol, benzos, in this case Xanax. Benzos are nothing but alcohols in pill form, and that's about correct. Their main place of action, even though alcohol is a much more complex set of systems it hits, is on the GABA receptors, which are the inhibitory receptors. And if you notice, certain types of alcohol have that same effect. In particular, hard liquor, and a popular one where this discussion occurs is liquor. So Xanax bars, okay, Xanax 2 milligram bars, seem to have even a higher abuse potential than your general benzodiazepine sedative hypnotic class. And in fact, they seem to be quite dangerous in creating amnesia, erratic behavior, superpowers, and in general things that the person wouldn't do otherwise. That about covers Xanax bars. Let's move to a related topic, and let's begin with the first question. Why do people drink alcohol and take benzos at the same time? There could be a whole host of reasons, but remember, as we just discussed about Xanax, both of these are in the general larger class of sedative hypnotics. So we can assume they have some sort of additive effect, right? And there might be minor variations for different people. For example, taking a bunch of Xanax and drinking alcohol might smooth out the high and euphoria from the alcohol. Or maybe it helps them get to a drunken state quicker. Or it might help their generalized anxiety and panic disorder quicker. The reasons are many, but essentially, you are having an additive effect by taking these two together. Why they started to do it, again, has a whole host of reasons, just as complex. What I have noticed with these folks is they usually and generally suffer from pretty serious anxiety and panic disorders that have never been addressed or treated. Here's the problem. What are the dangers? Well, sedative, hypnotic, each one by itself, taken enough, you can fall asleep and never wake up again. Alcohol has some other issues where the patient becomes so sedated and they eventually have vomitus and their gag reflex is gone and it goes down to the right main stem lung and they essentially choke themselves to death. But the point is here when you take two sedative hypnotics together, and if you take in large amounts or large enough amounts, you are really, really increasing your chance of overdose. So, one combination that I would say is definitely a no no and you should not take together is these two drugs. Okay? And when you go, and if you are in some sort of a treatment setting or addressing one of these issues or the other issues, please understand that you're really dealing with, on some ways, clinically and pharmacologically, with the same substance, and more than likely, the underlying reason that you are abusing one and the other is the same reason. So what I'm trying to get at is this. If you're taking 4, 6, 8 milligrams of Xanax a day, and before you were taking 2 milligrams and drinking alcohol, or taking 0 and drinking large amounts of alcohol, now you've replaced it with the Xanax, you're essentially doing the same thing. Of course, you don't have the cardiovascular damage, you don't have the gastrointestinal damage, you don't have the renal system damage, you don't have the liver damage, the detoxification system, you don't have the same exact central nervous system damage in terms of peripheral neuropathies caused by alcohol. But when you replaced it with a benzodiazepine or Xanax, you really haven't addressed anything, and that comes with its own large set of problems. It's the same thing with the other way around. If you replace your Xanax or any other benzodiazepine with alcohol because you thought you had a Xanax problem, now you've got a different kind of monstrous problem. And probably the real issue is the underlying problem has to be addressed. So the main danger with all of this is increased chance of very, very real, severe, and life-terminating overdose. The second issue is all of the issues that alcohol has in its short and long term, which I don't really want to get into in this video because alcohol affects many systems. And all of the issues that benzodiazepines have in the short and long term, most of them cognitive and central nervous system, and neuropsychological, which has to do with your speech, motor movements, memory. Those are all still in play. Alcohol is much more complex because, as I said, it has long-term effects on your cardiovascular system, on your sleep, on your central nervous system, on your cognition, on your gastrointestinal system, on your renal system, your kidneys, and so much more. So the long-term effects of both of those is all of those issues, and you're actually sandwiching them together. In terms of treatment, this is a topic I would like to really reserve in terms of the fact that what do you do when a patient has alcoholism and a benzodiazepine abuse problem at the same time? This becomes quite complex. Of course, every treatment for every patient should be tailored and it should be done under your physician's care. So I will tell you sort of general issues. For alcohol, there's 3 FDA-approved medications, and there's good, robust literature that psychosocial intervention is really important. And for benzos in general, I advocate switching to a long-acting benzodiazepine and doing a long-term taper. Those are separate ones, but together, again, it's a whole different animal, and I want to reserve that for a completely separate place and a separate video, because that's going to be a 15 to 20 minute just brief introduction and discussion about how to approach it and how one needs to be careful. One other thing I need to add is this particular cocktail of both alcohol and benzos is particularly dangerous because the general class of sedative hypnotics is the only class of drug abuse and addiction that acute withdrawals can kill you, send you off into a seizure. And the long-term withdrawal, especially with the benzodiazepines, are a nightmare to deal with. These include everything from sleep disturbances, tactile disturbances, GI upset, visual disturbances, dysphoria, anxiety, depression, panic attacks. So dealing with this combination is extremely difficult. It needs a lot of close care, and at the end of it, you still need to deal with the underlying issues that led the patient to where they are at. I would like to leave it at that. If you enjoyed this video, please go ahead and look above to my left and click. There's some benzodiazepine videos that you might find beneficial as well. Otherwise, please don't forget to click the subscribe and like button. I will see you soon.